Imagine walking into your local pharmacy, picking up a prescription, and wondering, where exactly did this medicine come from? Most of us don't give it a second thought. But what if I told you that a huge chunk of the medicines we rely on are manufactured thousands of miles away, often in factories with standards that might not match those here in the US? And more importantly, what if relying on cheap pharmaceuticals from China and India is putting American health at risk? Let's break this down. Over the past few decades, the US pharmaceutical industry has changed dramatically. Once, America was the powerhouse of drug production, but as companies chased lower costs, more and more of our medicines started coming from overseas, mainly China and India. Today, about 80% of the active ingredients in our prescription drugs are made outside the US, and the bulk of those come from these two countries. There's a reason this is happening. Cost. Manufacturing pharmaceuticals is expensive. Labor, energy, raw materials, and strict regulatory standards in the US all add up. Meanwhile, producers in China and India are able to make the same drugs at a fraction of the cost, thanks to cheaper labor, government subsidies, and sometimes less stringent safety and quality regulations. American companies, always looking for a way to cut costs and maximize profits, have steadily shifted their supply chains overseas. At first glance, this seems like a win-win. We get affordable medicine, companies save money, and everyone's happy, right? Well, not so fast. There are some serious risks lurking beneath the surface. Let's start with quality control. The Food and Drug Administration, or FDA, is supposed to oversee the safety and efficacy of all drugs sold in the US. But when drugs are made overseas, it gets a lot harder to keep tabs on every factory. There have been several high-profile cases where contaminated or substandard drugs slipped through the cracks. One example is the 2008 heparin scandal, where contaminated blood thinner ingredients from China led to dozens of deaths in the US. These incidents, while rare, highlight the dangers of relying heavily on foreign suppliers whose oversight might not be as robust. Another risk is supply chain vulnerability. Remember the chaos of the early days of the COVID-19 pandemic, when personal protective equipment and basic medical supplies suddenly became scarce? The same thing can happen with pharmaceuticals. If a natural disaster, political conflict, or even trade dispute disrupts production or shipping in China or India, Americans could face critical drug shortages almost overnight. In 2020, India temporarily limited the export of certain medicines to protect its own supply, sending a wake-up call to US policymakers. So what's the solution? Some experts say it's time to rebuild America's pharmaceutical manufacturing base. The idea is simple. Make more of our medicines here at home. That way, we have more control over quality, reduce our dependence on foreign suppliers, and protect ourselves from unexpected disruptions. But there's a catch. Manufacturing in the US is more expensive. That's where tariffs come in. Tariffs are basically taxes placed on imported goods. By making imported drugs more expensive, tariffs could level the playing field for American manufacturers. This could encourage pharmaceutical companies to bring production back to the US, invest in new plants, and hire American workers. It also means we'd cut out some of the middlemen that currently profit from shipping drugs all over the world before they end up in your medicine cabinet. But there's no free lunch. Tariffs could also make some drugs more expensive for consumers, at least in the short term. It's a trade-off. Pay a little more for safer, more reliable medicine, or keep chasing the lowest possible price and accept the risks that come with it. It's worth noting that in other industries, tariffs have had mixed results. Sometimes they protect domestic jobs and industries. Other times they just increase costs for everyone without delivering the promised benefits. Still, the stakes are high. The US spends more on healthcare than any other country. According to the Centers for Medicare and Medicaid Services, Americans shelled out over $600 billion on prescription drugs in 2022 alone. Ensuring that money buys safe, reliable products is a matter of national security as much as public health. There's also a historical angle here. In the mid-20th century, American pharmaceutical companies were the gold standard. They developed life-saving drugs, set global benchmarks for quality, and employed hundreds of thousands of workers. But as the industry globalized, many of those jobs and factories disappeared. Rebuilding that capacity won't happen overnight, but with the right policies, including targeted tariffs, investment incentives, and updated FDA regulations. It's possible. So where does this leave us? Should we accept the risks of cheap imported drugs in exchange for lower prices? Or is it time to invest in rebuilding our own pharmaceutical industry, even if it costs a bit more? Some policymakers argue that the long-term benefits, safer drugs, more jobs, and greater national security, are worth the investment. Others worry about the impact on consumer prices, especially for those who already struggle to afford their medicine. The bottom line is, there's no single cure for America's pharmaceutical dilemma. But as the debate over tariffs heats up, one thing is clear. The choices we make now will shape the future of our healthcare system for decades to come. If you found this breakdown helpful, don't forget to like, comment with your thoughts, and subscribe for more insights on how global money decisions impact your life. And as you fill your next prescription, remember, sometimes the story behind a pill is just as important as the medicine itself. What path will America choose? Only time will tell.